Why did I say that distinction between the RN and the LPN? Because most RNs who are working as clinical documentation integrity specialists do not hold any certifications at all.
Oh.
Yes. For the most part, RNs will use the knowledge that they have about ICD-10 codes and go into the CDI roles, clinical documentation integrity.
Okay.
You can be certified in clinical documentation integrity or not.
Hi friends, welcome back to my YouTube channel. My name is Brianna. For those of you who do not know me and maybe just popped on my channel to view this episode, I'm a registered nurse doing my thing away from the bedside and pursuing the field of healthcare informatics. So on this channel, I talk about being a nurse in healthcare informatics, after bedside journey, and just some other life scenarios. And in today's episode, I want to answer a question that came up on one of my, actually, I think it was my first video. And in my first video, I gave 7 tips on how to transition as a nurse in healthcare informatics using your most minimum experience. And one of the comments that came up on that episode was, somebody commented and said, I'm a nurse coder, but now I work in healthcare data analytics for a major insurance company. A lot of people were asking, well, how did you become a nurse coder? And so I thought that that was an interesting topic to start. I would like to know the answer to that question. And I'm super happy that someone who does coding actually viewed some of my content, reached out to me, and gave me an opportunity to tell my story on her platform. But today, I am going to let her help me answer some of those questions because I'm curious as well. My journey was trying to transition into somewhere in informatics or technology. I'd be really interested to know how you become a nurse coder, how do you market yourself to become a nurse coder, and just some of the things that a nurse coder does. So, super excited to have ACD4N, Advanced Clinical Documentation for Nurses. So definitely stay tuned if this sounds interesting to you at all. We're going to answer 5 questions. It won't be anything too long, but please definitely let me know if you find it useful. And yeah, that's it. All right, let's get started.
Yeah, I am the educational consultant for advanced clinical documentation for nurses and other clinicians, but my services are really tailored to nurses. And to answer your question, I want to start that off first to answer your question.
Yeah.
So the term nurse coder can actually be used to describe a few things or skills that a nurse may have. So it could be anything from knowing a coding language that a nurse is, so you're able to code in a programming language. So for example, it could be, Python, R, structured query language, SQL, all of that can qualify as being a nurse coder, right? But generally in the space, when you're talking about reimbursement, the term nurse coder, the word coder in there is really talking about code sets like ICD-10 code, CPT coding, that's common procedural terminology coding, HCPCS coding, that's the coding that you would see for let's say the Band-Aid, let's say that's being billed, for example, that's, any little device, anything that's really just a non-procedure, part of the care, that's a part of that care will be considered in that HCPCS coding. So coding in general, and let me just also be clear, that is an area I'm only familiar with, but ICD-10 coding is really the code set that that's what I'm certified in, and I'm specifically certified in risk adjustment. So risk adjustment is a statistical methodology that is really based on predicting the cost of care for individuals with a set of conditions that risk adjust. So So hierarchical condition categories, HCCs, is a classification of conditions that insurance companies essentially use to identify the financial burden. It's sometimes also referred to as like the disease burden per condition. Okay. So that risk score is essentially how payers are able to kind of, again, predict the disease burden for taking care of a particular member.
Okay.
So, simply put, nurses who have that knowledge and are certified in either risk adjustment or any other coding certification, because there are many other coding certifications that a nurse can acquire. Anyone actually can acquire. The great thing about those certifications is really about preparing yourself. You can, get a review book and prepare for the exam. Many individuals who prepare for those exams actually have some working knowledge, like they are working somewhere in the industry. So you're familiar with the concepts.
Okay.
Nurses in particular have a huge advantage because you're not teaching nurses disease process. Nurses know when a condition is getting worse.
For you to have become so knowledgeable in risk adjustment, if you could tell me your nursing journey, like from, you don't have to go super into detail on everything you did, but like give me a general synopsis of how did you even get into this? Like start from your nursing journey and kind of what took you there.
Sure.
I'm curious.
So prior to becoming a nurse, I was already working in case management. That was a space that I was doing as like more of a therapeutic support staff. So I worked with a therapy model. So it was behavior focus. It was more aligned with, that model. So it's more psychiatry kind of that kind of model.
Okay.
So essentially the mobile therapist would give me a plan of care and I would execute that plan. And I was working directly with children and their parents and also other leaders in the community that worked with that child. And a lot of it is just behavior modification. When I became a nurse, I still wanted to do that work. I had a passion for that. I loved, the coordination care. I loved the development of the care plan.
Yeah.
That whole execution
I
piece.
Identify with you on that.
Yeah, I really loved that piece. So when I became a nurse, I was really looking to stay in that vein. But I really never really thought about case management and nursing really ever being
meshing together like really?
No, I didn't see it at first.
Wow.
I never, because the nurses around me worked in hospitals.
Yeah.
I knew nothing about case management.
Okay.
So outside of working in that model, so that's prior to becoming a nurse.
Okay.
So I just went into behavioral health, which was the other thing that I was very familiar with, which is behavioral health, mental health, that kind of piece. So I went into that area. When I went into the behavioral health space, I noticed that for me, I really loved the idea of like documenting and working across that multidisciplinary team. I was still doing a lot of that, but this was inpatient psych. And while it wasn't like deadpans and turning, it was still very much a locked facility. You're very much on top of everything that's going on with the patients, but you're also managing a unit. So I'm managing all the behavioral health techs. I'm managing their schedules. I'm concerned with a lot of the operational stuff in that regard, right?
Okay.
So that was not quite what I wanted to do with my future. So I had actually, I worked in a few locations. I remember moving down to Florida shortly after working in that, that specialty area, that psych nursing. And I continued to work psych nursing, but I had moved down to Florida for a little bit. And then for whatever reason, when I came back to where I live in the PA area, I came back into that area. I decided to go with this opportunity that like a staffing agency reached out to me about case management. And I was like, case management? And they're described like, yeah, you're going to be working with some people with some behavioral issues, whatever. But, it's going to be the veterans population and you're going to be working through the VA system. And so I'm like, okay. It reminded me, and they hired me telling me, well, look, like you have a lot of behavioral health, background, and this is exactly the kind of population you'll be working with. Some have PTSD, some have, some some drug and alcohol background issues. So maybe this is going to be, very much in alignment with what you've done in the past. I'm like, okay, whatever. Loved it.
Really?
Loved it. So that's how I was introduced to nursing and case management.
Okay.
And so loved it. So after some time, I decided to go back to school. So while I was working at this job, I went back to school to get my master's in nursing education. I was back and forth if I wanted to do nursing education or if I wanted to become a nurse practitioner. And I think the thing about the nurse practitioner or nurse education, like if I was going to go for one or the other, I think for me it was a tough spot because a part of me wanted to do something that was very different, and of course, not really quite knowing what I wanted to do, either as a nurse practitioner or a nurse educator. I said, you know what? I think the nurse educator route probably be better because if you're not sure that you want to be a nurse practitioner, why go pursue that? Where nursing education was more in alignment with my values.
Okay.
Also, my first degree is actually in education because I thought I was going to be a history teacher, right?
Okay. All right.
Yeah. So I still love education, and that's always still been a very close, dear, place to me.
Yeah.
Just teaching and education, that piece. So anyway, when I went back to school to get my master's in nursing education, I started to learn more about the Affordable Care Act and how that was changing healthcare. I was in school at a very interesting time.
Okay.
It was literally all of the evidence-based teaching, all of the evidence-based practice was all aligned with this idea of access to care, coordination of care, getting more specific about the documentation, EHRs. I mean, it was this integration of technology. It was a real huge, I felt like I was almost in the center of a tornado.
Okay.
All of the hot topics, all of the articles that we were writing about, everything was just it's we'd be writing about it in school, and then I would look on the TV and someone would be
talking about it.
Maybe a hot topic in CNN or something like that. And I'm like, wow.
Okay.
I thought that I was in school at a really pivotal time in healthcare.
Yeah.
But again, I learned about all of this through case management.
Yeah. That's the other thing that we kind of align with because, I didn't do case management in an insurance setting. I did it more so in a community health outpatient setting, but it's the same kind of, similar to social work, but of course there's still the nursing piece that the social worker wouldn't necessarily have. And so being that glue made you more privy to making sure that the process worked correctly and that the documentation was on point, because if it wasn't, then how are we really going to accurately provide care, to this patient holistically and with integrity and just all the important things that matter so that the doctor knows, whether we're dealing with a left foot or a right foot. So I think you brought up some really good points. Assuming that I am a nurse in bedside, kind of looking to transition, and I'm looking for jobs. I guess because you got your certificate, it's a little bit easy. It was a little bit easier for you to kind of market yourself because you got that additional certification to move from case management to risk adjustment. Would you have any tips for somebody that wants to get into risk adjustment, but they're currently at bedside, kind of what their baby steps should be?
Two pathways.
Okay.
Most commonly, registered nurses, it's a little different for licensed nurses, but for registered nurses, for the most part, usually when a registered nurse has knowledge of, we're talking about prior to certification, just has knowledge of ICD-10 codes and can demonstrate that they're familiar, comfortable, they understand, the structure of ICD-10 codes. They understand the importance of ICD-10 codes. Simply put, you're applying a lot of what you know as a nurse, that pathophysiology, understanding, body system, disease process. You're applying a lot of that. So you already have a head start as a nurse. earlier about the LPN and the RN, because most LPNs may really have to go the coding route where they have to be a certified coder.
Okay.
Some cases people do get into, not just nurses, but anyone in general can get into coding roles if they really understand the guidelines and they're coding. But for the most part, when you're talking about professional coding, you really want to get that certification. Why did I say that distinction between the RN and the LPN? Because most RNs who are working as clinical documentation integrity specialists do not hold any certifications at all.
Oh.
Yes. For the most part, RNs will use the knowledge that they have about ICD-10 codes and go into the CDI roles, clinical documentation integrity.
Okay.
You can be certified in clinical documentation integrity or not.
Wow.
The AAPC has a certification. That's American Academy of Professional Coders. The American Health Information Association, AHIMA, and ACTIS, the Association for Clinical Documentation Integrity Specialists. Those are the three organizations that you can get the CDI certifications from. If a nurse is interested in going into, and I would say this is probably also the case to become a nurse informaticist, you find the opportunities where you're working, because then you can make a better connection about what's going on. Because if there's a department or a committee at the place where you're working that's overseeing those processes, that's going to be a better place for you to start than if you have to imagine all of it in your head.
Yeah.
Because if you have no prior knowledge and you're just going to say, well, I'll just learn about, which you can. There's a lot of information out on YouTube. There's a lot of training courses. There's a lot of individuals who have programs, myself included, the coding nurse. There are different pathways for you to learn about this information without going to school and getting a degree.
Yeah.
And of course, prior to your certification.
Yeah.
Because for your certification, you have to be competent and comfortable enough to sit down for those several hours to take that long exam. Because the exam just recently got cut down, but before it was 5 hours for the exam.
Oh.
You know what I mean? So, exactly. Which is something I think a lot of nurses don't really even realize. The coding exams are very long.
Sheesh.
They're very detailed. It's very much like getting your NCLEX. The upper hand that you have as a nurse, which is the advantage over everyone else who's sitting out taking that exam, is that you understand disease process. You understand anatomically where things are located. You have no clue how overwhelming it is for people who are not nurses.
Yeah,
who want to do coding certifications.
Yeah.
Because now they have to learn medical terminology. They have to learn where things are located. Some of the things that we have in our head as nurses, it makes it so simple for us to learn about ICD-10 coding because it just all fits together. You see the word pulmonary, we already know what's up here and talk about the lungs. Imagine if you have no medical background, you hear the word pulmonary, you're like, huh? Where's it located?
Right.
You know what I mean?
Yes.
That's a real issue. So
yeah. After getting all of this very specific experience, very unique, and I think very cool experience in this specialty of nursing, how did you know it was the right time for you to start your business? When did you know to start ACD4N? And also, tell me what services that you offer.
Okay.
Yep.
So I started my business when I initially started to prepare for my certification for clinical documentation integrity. The first exam that I was preparing for, I invested in a lot of training courses, tons of them.
Wow.
To the point where I realized, wait a second, this is a lot of information. So I started compartmentalizing the information, and I started to kind of organize it. And then after I started organizing, I thought to myself, if somebody wanted to know this information, I would just give it to them just like this. Go to this organization, try this place out, and then after doing this, then do this, then do this, then do this. So when I started to kind of organize and structure the way I was preparing for the exam,
okay,
that's when I really said I should be make this an official service,
yeah,
so that people really understand what they're getting themselves into. And then if you are not even in nursing, but you're like interested about learning about clinical documentation, just really, if you're interested in getting some medical coding, if I could be more specific, that was the rule that I said, okay, well, let me be clear that, you need to know medical terminology. So I purchased a book. I wrote out a whole curriculum for medical terminology, just to teach medical terminology.
Wow.
And a lot of this has to do with the fact that, of course, because my family is not from this country, sometimes I think about individuals who may be new to the country, and they may be very intimidated about like going into certain areas. So it's kind of like one of those ways of kind of giving back, but also kind of like being like a pathway for someone who's like new to the country, who wants to learn something that doesn't require financially, doesn't require a lot of commitment. And I could also make it more affordable for them.
I love that.
Right?
Yeah.
That was the primary goal in like really starting it.
I love that.
Yeah.
I was looking at your website and I was like, this is very affordable. What?
And I purposely wanted it to be very affordable,
yes,
because I had already spent a lot of my own money. So my thing about it is like, why make it so unattainable? And then my other issue, which is, I'm so glad you asked this question, I really was concerned about nurses just not knowing. Like, I thought for me, when I look back at it, I'm like, how did I not know this stuff?
I know.
It just seems like it was just smack dab in my face.
know.
Like, here it is. Like,
I know. I know exactly what you're saying.
The funniest thing about phrases and terminologies and terms and words, it's kind of like when you're doing like a research study. When you start typing in these key phrases and words inside of a search, whether it's Google or Yahoo or YouTube, and you get results, the more you expand like your languages and what you understand, and your personal lexicon, like the things that the words and phrases that become normal for you, when you start looking them up and you start realizing, you know what, the issue is that if I even search these things, I wouldn't even know to search these terms. I wouldn't even know how to put it into words. That's why when you asked the question of what's a nurse coder, I wanted to give a very comprehensive response, because I know for some people, they may think that a nurse informaticist is a nurse coder. And it's like, no, that's not a nurse coder, right? Because again, if something is foreign to you, you only relate it to what makes sense to you. So if I said to you that I was working on computers, I spend most of my day working on computers, you're probably going to say, oh, you must be a coder. I say, I'm a nurse. I say, oh, you're a nurse coder. And it's like, no, that's not what that is.
Yeah.
Again, even what I said about coding and CDI, if you're a registered nurse, because registered nurses are more often, once they have that coding knowledge, they're more often to be asked if they're interested in CDI roles, or have recruiters reaching out to them about CDI roles. It is not uncommon that a registered nurse without a certification is working in a CDI role. It's actually more common than not. But I created my business essentially to demonstrate that flow.
Okay.
And also empower nurses to document with specificity. Because, like, again, the title, the name of my company is Advanced Clinical Documentation for Nurses. It's really about nurses understanding the power of documentation, especially as we move deeper into, digital health and, informaticists